I'm standing here with Jason Seidel, a psychologist from Colorado, who's presenting at the ICCE ACE conference on a subject that most practitioners, I would say, are uncomfortable with.
Yes.
Stats and measurement.
That's right.
Why?
Well, because it's really good if you're using tools to measure your outcomes and to measure clinical alliance to understand what you're measuring. So what I'm attempting to do here tomorrow is to talk in depth about how to understand the numbers, how not to make a fetish of the numbers, and put them in context so you can use them clinically with clients in a way that makes sense, to use them sort of overall in the context of a whole practice or as an administrator, to understand how to make sense of all these numbers, but in a way that doesn't dehumanize the therapy process and really brings the most out of the numbers.
You know, you mentioned something interesting, because most of the time you hear about outcome measurement, we're hearing about accountability and reporting to payers. But you're talking about something, you mentioned something a little different here, somehow discussing this with clients. Numbers, stats with clients?
Yeah, I mean, to a degree, and sort of along the lines of the philosophy of monitoring change with clients is monitoring how much clients would even want to know the details of this.
Yeah.
So some clients are really interested in following their graphs of how they're doing over time and how their outcomes are changing, and really actually use the graphs pretty frequently in session, and it's sort of a way for them to check in with the process. Other clients, you know, they don't want to know too much detail. If it's useful to the therapist to know and to make changes or ask questions, great, but they would like that to happen in the background. So for therapists to have all the tools at their disposal so they can choose and know what to use with each client to the extent that it could be helpful to that client, that's sort of what I'm after.
And Jason, you've been doing this now for a long time, perhaps the longest of any psychologist that I know. You have a very reliable data set about your own practice. What's been the takeaway for you as a practitioner? What's surprised you the most?
Well, you know, I started doing this on June 14th, 2004. It was right after a conference in Austin, and I didn't stop after that. And initially, the very first week I started doing this, and I had a lot of trepidation about the beginning. I was nervous about it. But in the very first week, I was starting to notice really interesting stuff happening. For instance, surprising differences between what clients would report in terms of their well-being, their general well-being on the form, and then what I was starting to pick up in the room. And so then I would be able to ask the client, well, it's interesting because you said you're feeling really good on this form, but I'm hearing you talk about some real distress. Help me understand this. So immediately there was some really interesting discussion around the social presentation of self and how I generally like to portray myself to other people versus this other stuff that leaks out of me. So it actually, one of the surprising things was how much it deepened the process between us. Because it added this whole other layer of clients reporting on or sort of self-monitoring.
You're giving me chills here. It deepened the process in an era of cookbook and cookie-cutter therapies and short-term therapies. This deepened the process.
Yeah, and it was a numbers thing that deepened it. That's what was surprising to me, because I was really worried. One of the things that really worried me about it was how much it would try to either oversimplify the client or become cookbooky or unidimensional and all that sort of stuff. And immediately when I started using it, I was seeing that it really enriched the process. And that was really cool.
Let me ask you something about that. And you may have already answered it in your question with the excitement with which you talk about this, but a lot of clinicians pick up the measures and even start to look at the numbers, but then after a while it kind of loses steam. What's different about you? 7 years later, you're still doing this.
Well, I think for one thing, and I'm going to talk about this tomorrow too, I think it's really important to develop sort of like almost a ritual of how to present this and how to integrate it into one's practice. And so it becomes so automatic that it's just something I do. The other thing is I do quite a bit of medium and longer term work with clients. And one of the things that does happen, honestly, is after 10, 15, 20 sessions, it can become sort of rote or automated. And what I have to remind myself of, and again I'll be talking about this tomorrow, is to make sure I sort of re-engage the client or re-engage myself about what are we doing here with these forms, and to keep them real. So they actually are giving us the information that we can find useful in terms of tweaking what we're doing. And so it's just mindfulness, I guess.
Mindfulness. And on that same subject, you know, sometimes people say excellence. My goodness, excellence. I'm so tired just doing my regular job, filling out the paperwork and the forms, and now excellence. They find the term in some ways intimidating or off-putting. Your comments or thoughts about that?
Well, I guess to me it gives me a reason to get up in the morning and infuses my work with more morale and excitement and interest, and it sort of keeps it fresh and keeps it purpose-driven. I mean, it's sort of a cliche, but it feels energizing to do it that way.
Tomorrow, you're talking about stats at the ACE conference. I'm looking forward to seeing you, Jason.
Thanks.